Labor. So labor have 4 phases. Phase 1, which is dormant phase, and 95% of pregnancy is spent in this phase only. This phase is prelude into labor. Progressive softening of cervix occur here. Phase 2, activation phase and preparation of delivery occurs here, and cervical ripening occurs here. Now phase 3, stimulation phase or progressive of delivery. Stages of labor. Now there are 4 stages. Stage 1, from onset of contraction to full dilatation of cervix. Now stage 2, from full dilatation of cervix to delivery of fetus. Now stage 3, from delivery of fetus to delivery of placenta. Now stage 4 is observation for 1 hour after the delivery. Now phase 4, recovery phase, involution phase or purpura. Event occurring in phase 4 are uterine involution, spontaneous ripening of cervix, breastfeeding. Now stage 1. Stage 1 have 2 phase, latent phase and active phase. Latent phase generally occur around 8 hours and active phase generally around 4 to 6 hours. Include acceleration phase, phase of maximum slope, deacceleration phase and second stage. Second stage have latent phase plus acceleration phase of active phase. So it constitute pre-parity division of labor. Phase of maximum slope, dilatation, division of labor. Now prolonged latent phase. For nulliparous and multiparous both are different. For nulliparous more than 20 hours and for multiparous more than 14 hours. Now active phase disorders. Protracted dilatation for nulliparous less than 1.2 cm per hour and for multiparous less than 1.5 cm per hour. Protracted descent for nulliparous it's less than 1 cm per hour and for multiparous less than 2 cm per hour. Arrest of dilatation, no dilatation for more than 2 hours is called arrest of dilatation. Now arrest of descent, no descent for more than 1 hour is called arrest of descent, and these two are both for nulliparous or multiparous. Now maximum duration of stage 1 and stage 2 of labor combined. For nulliparous mean is 9 hours, up to limit is 18.5 hours, and for multiparous mean is 6 hours and upper limit is 13.5 hours. Now monitoring of labor. Station of labor. Ischial spine is a reference point from the station from where we can see the stage or the progression of the labor, and ischial spine is the narrowest space of mid pelvis. Now timing for of per vaginal examination is when the cervix is dilated more than 4 cm and regular contraction are present. Too early pelvic examination in active phase is done. Now partogram, and it is given by WHO. So with the partogram we can monitor the progression of the labor. Partogram charting is started at 4 cm cervical dilatation. Early warning system and following decision can be taken if labor progression is slow. Decision of transfer to a better center if labor progression is not going well, and augmentation of labor and termination of labor if the suggestion of obstruction have started coming in partogram. So partogram is basically very helpful so that we can take further step for the pregnancy or for the labor. And from the partogram we can monitor cervical dilatation, descent of head, fetal rate, liquor, contractions, and oxytocin administration, drug and IV fluids administration, pulse rate, BP, temperature and urine output or etc can be monitored from the partogram. Now what's the benefits of partogram? The benefits are that it's it can decrease prolonged labor, decrease chances of obstructed labor, decrease chances of uterine rupture, and reduction of MMR is ultimate goal of Partogram, and decrease chances of sepsis and decrease chances of PPH.